Welcome to the Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hi everyone, and welcome to the Hair Loss Show, episode number 32. My name is Dr. Vikram Jayaprakash.
I'm Dr. Russell Knudsen. Welcome.
Welcome to today's episode, and what we decided to do is talk about a topic that we get asked a lot about, which is if you've had a poor hair transplant, an outcome that's less than ideal, well, how can you fix it?
Right. So the first thing we want to discuss is what is a definition of a poor result. So what we are not going to talk about is where we failed to meet patients' expectations. So you can do a perfectly good surgery, perfectly good transplant, and have a perfectly good result, but the patient's expectation was so much higher than the outcome that was achieved that they're disappointed. That's not a poor result necessarily, that is a failure to meet expectations, and that's where the consultation with the surgeon is critical, because you need to understand the factors that are going to help you achieve your goals. The surgeon needs to understand your goals. He needs to be able to examine your hair in detail, and a photo won't cut the mustard here. You have to see it in the flesh so that you can actually check that you can actually meet the expectations, because there's no point in starting something you can't finish.
Sure.
So we're not talking about that today. We're going to talk about botched results. Now, botched results can be any number of things. Failure to grow is a botched result. Poor design is a botched result. Aberrant scarring that shouldn't be allowed to have happened is a botched result. So the unnaturalness by not choosing the correct graft and the correct direction where you place the graft, these are all things that can give you a botched result. So effectively, if you're trying to get to the bottom line, is something that looks unnatural.
That's right. And the key is that, I mean, there are a variety of different reasons why that can happen. I mean, a lot of the reasons that that will result in the outcome you spoke about is from poor technique.
Correct.
You know? And
poor planning.
That's right. So again, it's about making sure that you've had a sit down with your doctor, with your surgeon, and you've got the correct plan. You understand what the plan is, and you know that person has the skill set to be able to implement that plan.
So it all starts with the plan. So I want to dispel this notion that a surgery is a commodity, that 2,000 grafts will look this good, 3,000 will look 50% better, 4,000 look 100% better. That's not how it works. It's about the planning, right? It all starts with the planning. If you don't get the planning right, it doesn't matter how good the technique is, the result is going to be unsatisfactory.
Because I think the harsh truth of the matter is, the answer to this question is that you really can't. It's very, very difficult to fix something that wasn't done properly from the get-go. So it is absolutely imperative that when you set out on this part of the journey, that it's done, with your best foot forward.
So again, historically, because I've been doing this since the 1980s, I differentiate between repair work and renovation work. It sounds kind of a little bit strange, but to me, a renovation means it was a properly designed and properly executed transplant in its time, but we can improve it now that our techniques and technologies have become better. So it's a renovation of what was a good result for its time. Repair work means undoing something that was a mistake.
And it's really difficult. So what we've got an example of a patient, and so we'll show you, in this particular case, some of the things that have gone wrong. So this is a young gentleman that went overseas to have a hair transplant, and we've talked about overseas clinics before and the implications of that. But let's just go through the practical aspect of the outcome that this person has achieved. So it's a young guy, and so the thing that you need to can see first of all, young guy, relatively pale skin, dark hair, all right? So there's a big color differential between hair and skin. So you know that there needs to be higher density in order to mask that. But what we can see here, he's created a new hairline here in the bottom, but the density is poor, and you can see, it's become see-through. You can actually, most people could tell that he's had a hair transplant. With the eye of faith, you can probably, with my markers, probably made this harder to see. One, it's slightly uneven. The left side is slightly lower than the right. So that's one issue there. If we come over again to the hairline in the corner, one of the things that we can see is the hair direction is not ideal. The hair direction here is good, it's coming forward, but now the hair direction is coming out at odd angles over there, and that doesn't look natural. Especially when this young gentleman's got shorter hair, you can definitely see that these hairs don't look in place. They're coming out at different angles right at that frontal hairline.
And because he wears his hair short, that means he's going to have styling problems, right? He can't sweep the hair here. He's got it sort of coming to the side. The corner here is a bit blunt, really, considering where the takeoff point is when you look in this particular photo. But this just tells you how critical hairline design is. The first noticeability of any transplant is an incorrectly designed or executed hairline. It's the first giveaway. And this is the thing that takes a lot of skill on behalf of the surgeon. It takes a lot of knowledge, it takes a lot of training to get it right. When I teach courses each year about hairline design, it's the most fearful thing that the novice surgeon is trying to learn, is how to design correctly a natural looking hairline. It is absolutely critical to the success of the procedure. So this is poorly executed, not because it didn't grow, it grew, but it was poorly designed. And the fact that it grew is going to be a problem now because it's not growing as it should have.
So, I mean, one of the things the imbalance, shall we say, in hair on the hairline on one side of them is almost forgivable because that happens
and
in nature.
Correctable.
Yes, and that happens. But this is the bit that sticks out.
Unless you're going to remove the hairs, that's a lifelong problem. We've discussed this. Surgery gives you, if a surgery gives you a problem, it's a lifelong problem because it's going to continue. So that's these issues here. If we go to this central picture. And this was an FUE procedure done overseas. And FUE procedures performed skillfully are excellent. There's not a problem with it being performed skillfully, but part of the problem that we have here is we have very poor harvesting technique because the skill set required for an FUE harvest in the donor area is to get an even spread of the harvesting so that no area looks particularly thinner than the others. I mean, that's the whole reason for doing FUE in the first place, is to leave people with a non-noticeable donor area that looks relatively even. So you can see that there's classic signs of overharvesting here, particularly in this area where far too much hair has been removed.
Magnified it there. I think we've got the photo the wrong way around, but we can see, look, they've taken all this hair. There's like sort of
nothing left,
5 or 10 grafts in that area.
And they've harvested so strongly you could almost think that you had a linear scar along there. So you'd have to say, is that a strip scar or is it an FUE scar? It's very poorly performed.
Over here
very
as well.
very abrupt up here. Far too much harvesting here. There's no hairs being left in here. So even if this patient had a wonderful result on the front of the head, we now have transferred the problem to the back of the head. Because now we have unsightly scarring. I mean, one of the things that patients come to us asking for FUE about is so that they can shave their head. Well, this gentleman can't shave his head for the rest of life. And guess what? We aren't going to rob hairs from somewhere else necessarily to try and fix the area. We might be left with having to do that superficial tattoo technique that we call scalp micropigmentation to try and give him some relief, because a short haircut, let alone a shave, is going to expose a very bad planning of the donor area.
And I can tell you, I'm sure you agree with me, that the person or the clinic that did this surgery was obviously trying to make it easy for themselves, because what they've done is they've taken a relatively small area and said, I'm going to harvest just from that.
Thousands of grafts. And haven't
looked at this area. And this is harder too, because you can tell the angle of hair, the angle that the hair comes out of the scalp is all in that sort of direction, and this part it starts to go, so you're going to have to move around. So actually FUE, when you're doing it, it requires you to move around the patient. If you just want to sit in one place and just do it in a very comfortable manner, you're going to get this scenario where you've got this window and you've just harvested from there with well-defined edges. So this is
the summary for this patient of having to fix this botched hair transplant is he needs more hair in here, maybe a little bit of hairline correction. We may actually have to remove some of these grafts, punch them out and reorientate them correctly to get the hairline designed correctly. And pretty much all we're going to do back here is offer him scalp micropigmentation to make it look like it's thicker than it really is. So it's a complicated subject, and this is a specific case, but some things we can fix easily, other things are tricky to fix, and some things are unfixable. So if you get, for example, 10% growth and someone's harvested 5,000 grafts, we can't fix that problem, right? Those 5,000 grafts are gone, you've got 500 grafts growing, that's an unfixable problem. So sometimes we can, sometimes we can't. And it really does base on that. But I go back to our point here is planning is key, right? It's not about the number of grafts, it's where you take them from, where you put them, and getting the planning right. I hope you found this a little bit helpful. But I know it's a complicated topic and we've only given you a single example, but it does explain to you why it's a complicated topic and why you need to speak to an experienced surgeon if you have a concern about what's been performed and how it might be corrected.
Hope you find that helpful, and again, please leave a comment in the comment section below, and we'll see you on the next episode.
Bye.